Hello, everyone. We just want to start out by saying thank you guys for taking time out of your busy day to listen to this presentation. Hopefully, it won't take too much of your time. My name is Kaylee, and then there will also be Afton and Bailey speaking to you guys today. So, who are we? We are three seniors at the Utah College of Dental Hygiene in Orem, and we are very passionate about oral health, serving others, and educating our peers on the importance of a healthy mouth. We are so grateful for your guys' participation in this research project and hope that you guys can learn something new these next 4 weeks. So we have 4 goals for you guys for the next couple of weeks that hopefully you guys can implement into your guys' daily life and make this a lifestyle change. So the first one is reduce snacking. The second one is limit energy and sugary drinks. The third one is increase brushing. And the fourth one is increase xylitol intake.
So one of our goals was to reduce snacking, and we want to reduce that because if we're constantly snacking, it means the mouth is in an acid environment, which can be hard on enamel, causing higher chance for tooth decay, and that could mean time off of work to go in and get restorative work done if it's needed. We want the mouth to be in an anti-cariogenic state, which means we have to wait 30 minutes after eating for the mouth to return to the neutral pH state. So we want to reduce snacking, but if you are going to snack, there are better options, which would be like cheese or nuts, because they have a high level of phosphate and calcium found in them. They're going to strengthen the teeth and bones. They are also going to be less sticky, so it will cleanse the saliva as well as wash them down faster instead of being stuck to your teeth. Worse options for snacking are going to be things like candy or chips, which they're very high in sugar, and if it gets caught between your teeth, that will stay there until you're able to remove it by flossing, which could be a while depending on your shifts at work. If they're not treated properly and it turns into decay or cavities, then again, taking off work could be an issue for you, but it could also cause severe pain and possible tooth loss. Then I just liked this quote from the Journal of the American Dental Association. It says, "When you eat or drink, the plaque bacteria digests any sugars and produces acid that attack your tooth enamel. The stickiness of plaque keeps these acids in contact with the enamel for some time after you've finished eating or drinking. With repeated and prolonged exposure to these acids, your enamel eventually can wear through, resulting in caries or decay." So we just want to try and reduce snacking in your daily life to help decrease the chance of needing restorative work.
Okay, so next we're going to be talking about limiting energy and sugary drinks. The first thing we will be addressing is how energy and sugar drinks affect oral health. And the main reason is the frequent exposure to acid. When our teeth are exposed to acid, it can cause something called dental erosion, which is a chemical process that can lead to softening and loss of teeth. So it's basically the process of acid eating away at the teeth. And the most important part of this is going to be how frequent we are sipping on acidic drinks, which we're going to be talking about in the next slide. So why is frequency so important? The more our teeth are exposed to an acidic environment, the teeth start to demineralize due to the low pH of the mouth. Most soda and energy drinks also contain high amounts of sugar, and combine that with the acid, it eats away the teeth even faster. So what can you do to prevent this from happening? And the main thing that you can do is drink your soda, energy drinks in one setting, either with a meal, or if you just try to drink it within 30 minutes to an hour. The worst thing that you can do is sip on it throughout the day. You could also use a straw to minimize the exposure on the teeth. You can drink water to also help balance the pH. You can also try chewing like a piece of xylitol gum, which again is just going to help the pH return back to normal, which when you do have a low pH, that's when the teeth start to demineralize. So it's really important to get the pH back up. And as you can see in the picture, that is actually an example of dental erosion from someone who constantly drank Mountain Dew. You can see that it's basically eaten away at his teeth. So
the next thing that we want to talk about is increased brushing. So first we're going to talk about what plaque is. Plaque is a sticky film that coats your teeth, and it contains lots of harmful bacteria. And if it isn't removed when it's soft, then it will harden and become difficult to remove. This is what they are removing at the dentist when you go and get your teeth cleaned by a dental hygienist. They're removing this hardened plaque, this hardened bacteria off of your teeth. Plaque leads to an increased risk of dental decay and disease in the mouth, and it actually starts forming 5 minutes after it is initially removed with a toothbrush. And then within 24 hours, it can harden into a substance called calculus or tartar, like I mentioned before, what your dental hygienist is removing. So this means if you go 24 hours without brushing your teeth, that bacteria in your mouth is actually hardening into a hard substance that you can no longer remove with a toothbrush. That's the job of a dental hygienist to remove. So it's important to brush your teeth 2 times a day. And why is it important? It removes acidic bacteria. It can reduce bone loss. Periodontal disease or gum disease is linked to other systemic diseases such as cancer, stroke, and diabetes. And this doesn't mean that it causes it, but it does worsen symptoms. Periodontal disease, if it is left untreated, will eventually cause tooth loss. So that picture on the right shows you on the left side what healthy gum tissue and the healthy surface of the root of the tooth should look like. And then on the right side, it shows that tartar, and then that bacteria causes that bone to resorb and that gum tissue to become really inflamed and irritated and swollen. So this is how we can prevent that. And this is the ideal oral hygiene routine. You should be brushing 2 times a day for 2 minutes each time. You should be flossing 1 time a day, rinsing with mouthwash 1 to 2 times a day, and repeating this every day. Because like I mentioned above, that plaque can start forming again on your teeth even 5 minutes after you initially brush it off. And it's really important to visit your dentist every 6 months to get a cleaning and a checkup and just make sure everything is okay. So the fourth and final thing we want to talk about is xylitol. We want you to increase your xylitol intake. So what is xylitol? Xylitol is a natural sugar alcohol that is found in plants, including many fruits and vegetables. It tastes sweet, but unlike sugar, it does not cause tooth decay. It's what we call anti-cariogenic. Xylitol is also an ingredient in some dental care products, including toothpaste, mouthwash, and other fluoride products. So this is a quote from a study that I read, and it states that xylitol reduces plaque formation and its bacterial adherence, which means it's antimicrobial. It inhibits enamel demineralization. Enamel is that hard coating around the outside of the tooth, and it has a direct inhibitory effect on mutant streptococci. So how much xylitol should we be consuming daily for it to make a difference? So you should have 5 to 7 grams 3 to 4 times a day. So 20 grams-ish in total per day. And it is most efficient after meals or snacks because that xylitol, that anti-cariogenic sugar alcohol, interferes with the carbohydrates in your meal that you just ate. So these are some kind of popular gums on the left that you guys have probably seen before. So an ice cube, 1 piece of gum has 1 gram. The Mentos brand has 1.5 grams per piece, and then the two brands on the right side of the screen are actually advertised as xylitol gum. So Spry has 1 gram per piece, and Pure has 2 grams per piece. So these are really good to eat, like I said earlier, after meals and after snacks. So after you eat your lunch or your dinner, just pop in a couple pieces, chew it for just a couple minutes. It doesn't have to be super long. 5 to 10 minutes is perfect. And then that will hopefully help reduce the amount of bacteria that's present in your mouth. So that's something really cool that I think not a lot of people know about. Okay, so that kind of concludes the 4 main goals, the 4 main topics that we really want you guys to focus on these next couple of weeks. We had you take a pretest that just kind of gets your baseline of where you're at right now, and then in a couple weeks we'll just send out a post-test. Should only take a couple minutes. We'll have you answer the questions, see if there was improvement, see if you guys made any changes to your guys' diet, your lifestyle, anything like that. So thank you guys. Thank you so much. We are so thankful that you guys took time out of your busy schedule to listen to this presentation. And then we hope that you guys learned something new and will consider adding these new techniques to your daily life. If you guys have any questions, feel free to reach out to us and we would be happy to answer them. We look forward to seeing your guys' improvement in these next 4 weeks. So thank you guys.